Hello, Dr. Chavi Gautam, candidate number 12345. May I proceed?
Yes.
Thank you. Hello, my name is Dr. Gautam. I'm one of the doctors here.
Hi, doctor.
Hi, can I get your name, please?
I'm Lenore Howard.
Hi, Lena. And I can see you are here for your baby. Can you please confirm your baby's full name and age for me?
Yes, this is Abby Howard, and she's 9 months.
Okay, thank you, Lena. Uh, and you are her mother, right?
Yes, that's correct.
Okay,
Doctor, I'm
thank
really
you.
worried about Abby. She fell down from the sofa about an hour ago, and she has this bruise on her head. I'm really worried for her.
I see. Um, Leonard, I will don't not to worry, Leonard. We will try to help you, but to get a better understanding of the situation, may I please ask you a few questions?
Sure.
Yeah. So you told me that Abby was on the sofa and she fell. So I mean, has someone witnessed that?
Oh, yes, I saw that. Yeah, I was the one who was there.
Okay. And how is she now? What is she, like? Is she conscious? And
Yes, doctor, she's perfectly conscious. I mean, I think she's fine right now, but I'm
okay.
still worried. There's a bruise on her head.
Yeah, no, I can understand that might be quite scary for you. But to get the understanding, so will you tell me what was she doing at that time? Like,
I was, uh, I was actually changing her sister's diaper while, I left her on the sofa. She was just lying on the sofa, and the next moment I see she's on the floor, and she was crying uncontrollably when that happened. I'm so worried, doctor.
I can understand, Lena, uh, and but will you tell me how, like, what was the height of the sofa at that time?
Um,
I mean, how high was the sofa?
I don't know. I think approximately, half a meter high, perhaps.
Okay, and you told me that she started crying suddenly. So was there any other, I mean, any swelling?
Yeah, she has this swelling on her on her head. It's a nasty looking bump.
Okay, and do you have any idea how big is the bump? Like
Mm,
one
I mean,
centimeter, like just general idea.
I'm not sure, doctor. I haven't
Okay,
measured it.
okay, no worries. And when she fell, was there any like was she unconscious?
No, doctor. She was just crying uncontrollably.
No, yeah. And was there any abnormal jerky movements?
No, nothing that I noticed.
Any vomiting, like during or after her fall, like
Yeah,
after she fell?
yeah, she did. She did vomit once.
Okay, once. All
Would
right.
would you be worried about that?
I mean, we will see, Lanner. I just need to confirm with a few more questions, and then we'll see. I mean, how we will proceed with the treatment. Is that okay? Yeah. So tell me, Lana, um, has this ever happened before, or is this the first time?
No, doctor. This is the first time. I've been so careful with her. I mean, she's my 9-month-old baby.
Yeah, I can see that you are a good mother. So, but Leonard, um, it can happen with anyone, right? Despite our full carefulness. But tell me, like, uh, is there any other injury apart from this head or any other concern?
No, doctor, I'm just worried. I mean,
Yeah.
she's small and she hit her head. Just want to make sure everything is all right.
Yeah, don't worry, Lana. We will try to make sure that everything is okay with her. Okay, so that's why I'm asking you so many questions. Okay, tell me um, something that has she got um, any medical condition?
No, doctor, she's perfectly fine.
Has she got any allergies?
No, not that I know of.
And she or you have any family, like family history, family condition of any, like bleeding tendencies, like, I
No,
mean,
doctor.
any bleeding disorder?
None, doctor.
Okay, that's reassuring.
Mm.
Um, okay, Lana, and I mean, few more thing about your, just to have better idea, understanding of the situation. Who else lives with you with Abby?
Well, it's me, her sibling, and my husband.
Okay, and you told me it has never happened before, right? It is the
Mm.
first time.
Yes, doctor.
Okay, all right, and everything with her birth, like, was she a normal baby?
Yeah, yeah,
No,
everything was
normal,
absolutely
no,
normal. It was perfectly
yeah,
fine.
delivered. Okay, and is she up to date with her jabs?
Yes, doctor.
And regarding all other her development, are you happy with that? Like, is she going? I mean, in line with her miles, like with her development?
Yes, doctor. She's growing great, but I'm really worried about this fall, doctor. I've heard that they do CT scans to make sure everything is fine. Is that something that we can do for her today?
Lena, we will see, and if the CT scan will be required, we will definitely uh, do it for her. But we need to be very sure if it is required, only then we will. Otherwise, I mean, putting the child through the radiation is not very good, right? So we will see if it is necessary, we will definitely do it. So not to worry about it. Um,
Yeah,
so
but
let me,
nasty bump on her head. I'm sure that you could do a CT scan just to make sure everything is fine.
Leonard, yeah, I will try to, like, we will try to see, and if it, like I mentioned earlier, don't worry. If it is really required, we will do it. But if it is not, I can, like, I can suggest that it's not a wise idea to put the baby through radiation so much, right? So before moving forward, Leonard, is it okay if I do a quick examination of Abby?
I'm sure, doctor.
Okay, thank you. So I can see the baby is
What is
fine,
the
and
examination?
yeah.
So
So
when you mention examination, doctor, you have to verbalize what you would like to do. So the
okay,
simulation actually hands you the findings. So unless you actually mention what you are planning to do, nobody will
mhm.
give you the findings, right? So verbalize what would you like to do. So what are the examinations you'd like to do?
I can see. I would like to do a general examination of the baby. I can see that the baby is fully alert and
We don't have
playing.
that information just yet, right? So
Sorry.
don't make up. If you don't have any information, don't make it up. So when you
Okay,
say
okay,
examination, they will hand you the information. So like in this case, if you mention general physical examination, ENT examination, I would examine her head to check for any fontanelles, bulging in the fontanelle area.
okay. Hmm.
And I'd like to check her pupillary exam. I'd like to do a pupillary exam. Then only will you get this finding.
Okay, just because from, all right, okay. I might have misunderstood because the scenario said the baby is well, doing well, so that's why I said these things. But yeah, I understand. Okay, so I'm going to do the general examination of the child, and
The,
I'm going to look for, sorry.
the station is over. Like you finished
Okay.
your. So let's talk about it a little bit more. So
Mhm.
you get the it might have been something that the nurse must have must have assessed the child and she could have written it in the notes. So whenever you are going to give your assessment, you have to be the one to do the examination. That's why this patient has come to a doctor, right? So they will be
Yes.
telling you whatever their concerns are. Those are only symptoms. Those are only things that the patient is seeing that the child is experiencing, right?
Mhm.
What you do in your examination and you elicit, those are called signs. And those are the things that you are trying to do, those are the things you're trying to elicit when you do examination. And so it's very important that anything that can be elicited, you have to, try to do that by doing the, relevant examination. So in this case, you will be examining the bruise because you want to know how big the bruise is, right? Maybe the mother
Yes.
doesn't, was like, I don't know, it's just nasty looking. Like according to her,
Yeah.
it looks nasty, but is it actually nasty is something that you have to find out, right? By actually
So
doing measurement.
yeah, sorry. So shall I just say quickly that I'm going to examine general examination of the child, and I'm going to examine the injury site, and I'm going to look for any discharge from ear, eye, or any nose,
Yeah,
any other
mention
place. Yeah.
whatever the examination that you'd like to do. Right. So you
Okay.
have to put it into words. Like I'd like to do general physical examination. I'd like to take a look at the vitals,
Yeah.
including heart rate, BP, whatever it is that you'd like to do. Sometimes you might have to do some specific examination where you'll have to do an eye examination, ear examination. I'd like to examine the tummy, or I'd like to do some bedside examination in the form of urine pregnancy test, dipstick. Like those are if you only verbalize that, they'll give you the findings for it.
Okay. All right. And then it, and you told me that 8 minutes are over, and I haven't even reached to the examination, right?
Exactly. So remember, guys, you have exactly 4 marks for data gathering and 4 marks for management and 4 marks for interpersonal skills. So as soon as you hear the 2-minute bell ringing, wrap up the case, move on to management as soon as possible. Even though if you ask a few questions, like a few questions that you might have,
Yeah.
you went into such detail about developmental history, birthing history, those were actually unnecessary. By
Yeah.
asking
Yeah.
those questions, you actually wasted time because at this point you're actually running out of time. Go on to management, get some marks in management, right? So that
Okay.
is very important. So let's quickly take a look at the marks for that. All right. So let's see. So this time you confirm the full name, you confirm the age of the mother as well as the child. Good job on that. See, your management was like you got good marks, but then, sorry, data gathering, you got like 3, management is just 1. So you could have actually got more marks if you actually went to management by the time you actually hear the 2-minute bell. Start wrapping up the station where you start giving safety netting, what the mother can do instead of a CT scan. Right? Safety netting, give a leaflet, set up a
Mhm.
follow-up with GP, right? So when you hear the 2-minute bell, in your mind you should start wrapping up the case, right? Instead of asking more questions. All right. So open question. So I started off by actually telling you that Abby fell, right? So
Yes.
you could start with an open question, like, could you tell me a little bit more about the incident, about the fall, right? So
Mhm.
anything more that I had, I would have just mentioned it. Always try starting with an open question. The first question was a little closed. I'm going to give you a no for this one because,
Okay.
if you actually give an opportunity for a patient to express themselves, they will actually tell you what is exactly their concern mainly, what made them come to the hospital in the first place. So give them that opportunity right at the beginning, right? So always start with an open question
Mhm.
or the exact
Okay.
mechanism of fall because this is something that's important. Good job on asking the questions. Explore the symptoms immediately after the fall. Any loss of consciousness, seizures, abnormal movement, confusion. Was she feeling confused? Did she vomit? Good job. Ask about the red flags. Any drowsiness, repeated vomiting. So how many times did she vomit? You heard she vomited, but how many times? That's very important,
Yeah,
right?
it was like, and when I ask again that when you like, when the patient mentioned that one time, and I ask, okay, I confirmed it that she vomited only once, isn't it? I,
Yeah, all right. Sure,
yeah,
sure. Then it's considerable, yeah. If I said once itself, yeah. Yeah, if you've managed to elicit that, then it was just once. That's important because that's one of your criteria, right?
yes, yeah,
Bleeding or fluid from the ear or nose or any unusual behavior. Screen for any non-accidental injuries, any other unexplained bruises or injuries, any similar incidents in the past, who lives at home, is the father biological, so good job there. Inquire about past medical history, medication, and developmental milestones, any known condition that Abby might be suffering from. Confirm vaccination history and birth history, any complications during pregnancy or delivery, type of delivery, neonatal issues. Yeah, that's a non-important question. because at this
Yeah.
point it would give you much information for the management that you're looking for. ICE, right? ICE is very important to understand what exactly is it that she wants from you. But in these cases, the patients actually come out and ask you, demand, make a demand for their requests, right?
Yes.
Vitals, general physical examination, and specifically mention what examination you'd like to do. And especially, I'd like to examine the bruise itself, right? So
Okay.
especially
Yes.
explain the diagnosis, reassure the mother that it appears to be a mild head injury, explain why a CT scan is not necessary due to the mild nature of the injury and the risk. That was good. Clarify why the what the bruise means and why it is not a major concern. Right. So what do you think the bruise means? Why do you think it's not a major concern? Oh, I'm not sharing this page.
So basically, it is the bruise is there as a body's reaction to.
Yeah, yeah, that's good. That's good. That's actually good. You're
Yeah.
actually putting it into words.
Yeah.
Yeah,
Yeah. So it is.
first injury.
Yeah. It is not dangerous because and can we
Yeah,
say that the swelling you are seeing outside is really helpful rather than like any internal injury? Shall we? Can we say these things?
try to over explain. See, if you over explain, then you're going into more detail. So then she's like, "What do you mean internal injury? I want you to do the CT scan to make sure of that, right?"
Okay.
So
Yes. Yes. Yeah.
to explain, what, a swelling on the head, it's quite common after a minor injury. It happens,
Mhm.
because some small break in the vessels and, little fluid collection at the site of injury. It's a normal reaction. Try to normalize the situation. Like if you're going to
Okay.
use words like internal injury and stuff, it's gonna come more into that kind of a
Yeah.
conversation. Right. Just say that
Yeah.
it seems the swelling seems like a minor swelling, which is a normal reaction to such a mild injury. That's as simple as that,
Okay.
right?
Yeah. Yes.
So yes, let's take a look. Explain the CT scan is not necessary. You mentioned that. Advise observation in the emergency department for 4 to 6 hours to monitor. So you mentioned that, yeah, in a way, you mentioned that we'll observe her, yeah, instead of looking for any delayed symptoms. Provide a clear list of warning signs. This is very important to do, especially when you're sending the child home or if you're planning to send the child home, especially for a mother who's so worried. Give them signs to look out for, manage them like that.
Mhm.
Look out for the next 48 hours and mention a couple of those symptoms, right? Safety netting, emphasize the importance of returning to the hospital if any concerning symptoms develop. Provide leaflets about head injury and additional guidance. Inform Lena that a senior doctor will assess Abby before discharging for reassurance and confirmation, right?
Yes.
Uh,
Yeah.
his mother is going to be very difficult. They would be very insistent on the fact that they want the CT scan. Even after explaining, they'll just keep being insistent, saying that no, I'd feel better, if you do a CT scan. So then finally, you can always say that, I can ask my senior to, take a look at Lenore just before leaving.
But is it all right, like the way, because every, like you can see 3 to 4 times the patient asks that I'm worried for city, and I explained it twice probably. So is it all right every time we need to like, because we can't check the patient, and when they are concerned and we need to say the same thing again and again. I
Paraphrase
mean,
it. You'll have to explain what the point is. Try to paraphrase it a little bit. Say that at this point, Abby's health is our primary concern, and given that we don't see the need for any CP, right? Always try to paraphrase your words in how you can address it.
so yeah, yeah. So, I mean, Dr. Ann, can I ask, like, I know in my defense, there is just one thing. To be honest, I couldn't hear the bell at 6 minutes. So I was thinking in my mind, when I hear that bell, I will come to quickly jump on the minute management.
I
But
see.
yes, I mean, time management is definitely I mean, restraint for me, really. But apart from that, I mean, any feedback, uh, I mean,
So we've actually, so I don't know if you had a chance to look at the workbench. So the workbench
Mm-hmm.
that we have created, it's actually created by Dr. Rohit and myself, and we've actually created after going through the same process of PLAB 2. And these were the main concerns that even we've had, where we couldn't manage to fit in all the points in 8 minutes. So we've created a feature called the consultation guide. So this is something that actually, so we've designed it in such a way that every 30 seconds you would know what to do, right? So this is something that we are hoping
Mm-hmm.
while you're practicing. So we have a
Okay.
couple of that are free that you can try out, and you can try practicing with the consultation guide in front of you, right? So try to do that particular aspect in that 30-second window. So in this way, we've given an
Okay.
ideal cover the whole scenario in 8 minutes. So do try it out,
8 minutes.
and
Yeah.
to get the full brain bank, we are offering a 20% off for everybody who joins our session. So I'll ask the examiner to put in the coupon code so you guys can get your own brain bank subscription from that. So
Okay.
I'll just quickly take you through the entire list that we had for this time's, attempt. So the other important points that were missing were informing the seniors and setting up a follow-up with
Yes.
Abby's, GP to make sure that she's recovering and developing well, documenting the encounter, especially the history findings, the red flags, and the discussions that they had about the C team, right? Interpersonal skills, use empathetic language. That was good. You were actually responding very well to the patient. Provide clear, simple explanation to elevate her worries. Effective communication, summarize the information provided to ensure understanding. Answer all questions. Answer all questions patiently and thoroughly. So that's good. Even if they do ask repeated questions, you have to try answering them, right?
Okay.
Try to paraphrase it here and there, try to highlight the fact that Abby's health is our primary concern at this point, and we'll do the best we can to make sure nothing dangerous happens to her, right? Maintain calm and patient-centered approach throughout, avoid medical jargon, and ensure Lena feels heard and supported. And a couple of things you have to do is make sure to get to management in time. Time management is very important. And examinations, yes, verbalize all the examinations that you would like to do. All right, guys, so that was our case repeat. Thank you so much, Dr. Chavi.
Please like and subscribe to Turing Med School. Good luck with your preparation.